I finally had some blood work done to test my thyroid function, and today I'm going to talk about that in this video. Hi there, my name is Sue. If you've not visited my channel before, I've been on a carnivore diet now for a little bit over 20 months. And although I have lost some weight in that 20 months, it has been painfully slow. And I've had quite a lot of viewers ask me in the comments whether I have had my thyroid function checked. And I had to say that no, I haven't. I actually suspect that I've had a sluggish thyroid pretty much all my life. And I came to that conclusion quite a lot of years ago. I have had thyroid issues in the past that were tested. So I had an overactive thyroid in 2011, but I've had no tests done for 10 years now. In the past, I've taken my basal temperature on a very regular basis, which is when you take your temperature first thing in the morning when you wake up before you get out of bed. And I used to do that pretty religiously, and my body temperature was always low. So it should be around 36.5 to 37 degrees. My temperature would regularly be under 35 years ago. So I've started taking my basal temperature again just recently after watching a video with Paul Saladino. And I've been finding that my temperature is sitting around 35, just a little bit over. So it's better than it used to be years ago, but it's still lower than it should be. Now let's have a look at and see what the common hyperthyroid symptoms are. So these are common hypothyroid symptoms. Hypothyroid is an underactive thyroid. And the first two columns are probably the most commonly discussed symptoms with this condition. You'll see there that we've got fatigue, depression, constipation, dry skin, weight gain, puffy face, hoarseness, joint pain and muscle aches in that first column. Now, for myself, I've had probably most of those for a big chunk of my life. So the fatigue has always been a thing, and the depression. Constipation used to be when I was a lot younger, and then my gut health changed and got worse, and then the IBS diarrhea became a thing. So that's not a hypothyroid symptom, but constipation was definitely a thing when I was a child and a young teenager. Dry skin was definitely a thing. Weight gain, obviously, yes. Puffy face is something that has happened to me off and on, and I always kind of put it down to cortisol, but when my health isn't good, that puffy face thing is something that definitely happens, and I kind of lose the features of my face. Hoarseness is something, you can hear that in my voice now, like it's been quite noticeable of late, and that's been something that's been off and on, but more so probably as I get older. And joint pain and muscle aches have been something that have been kind of ongoing for me for a big chunk of my life as well. And I just kind of always put it down to that's just the way I am. I had a lot of years where I did a lot of exercise and I was always sore, and I just thought it was because I was exercising. What I find now on the carnivore diet is that I actually get a lot less sore when I exercise than I used to, but I still have patches where I have a lot of muscle aches and pain, and I'm wondering whether that is though to do with oxalate dumping more than anything else now. Now, the second column, we've got muscle weakness, elevated cholesterol, heavy or irregular periods, thin, brittle hair and nails, slow heart rate, sensitivity to cold, impaired memory, and an enlarged thyroid. Now, again, I've had a lot of these for big chunks of my life. So the muscle weakness has always been a thing. Even as a child, I had this real kind of weakness in my legs, and that's been something that's been there on and off as an adult as well. Eating meat helps, I find, with that, because when I went from vegetarian back to eating meat, that was something that I really noticed, was the change in the muscles in my legs and the way that they felt. So meat definitely seems to help me with that. The elevated cholesterol is something I'm not sure about. Heavy irregular periods has definitely been a thing. So that was a thing for me all of my life until I hit menopause. Thin, brittle hair and nails have also been a thing. And my nails go through stages. So I go through stages where they'll be quite strong and then they'll get really brittle again. They used to be really soft and brittle when I was young. Absolutely, I just couldn't grow them long. They were hopeless. So the slow heart rate has been a thing in the past when my thyroid was overactive, and then it started to kind of come back towards normal. My heart rate was really slow. Like I was taking my blood pressure and heart rate regularly, and both were very, very low. My heart rate would often sit around 48, 50 beats a minute. My father said to me, "You must be really fit," and I said, "No, that's not the case." I mean, I was getting some fitness back, but my heart rate was just really slow, and so that's been something that's been fairly consistent. It had started to go up over the last few years, but has come back down to a good rate now. Since I've been on the carnivore diet, it was starting to get too high for my liking prior to carnivore, but yeah, had traditionally been slow. Sensitivity to the cold. I was always really sensitive to the cold, except for when my thyroid was overactive, in which case I was really sensitive to the heat. And as I went through menopause, it kind of varied. I seemed to be sensitive to both, to be honest. I still have stages now where I seem to feel the cold, but again, I'm a lot better than I used to be, and since I've been on the carnivore diet, that's helped immensely with that. Impaired memory and enlarged thyroid gland. If I've talked about my memory prior to going carnivore, it was starting to become a bit of an issue that I was noticing, and my cognition, and the enlarged thyroid gland when my thyroid was overactive. And for probably, I don't know, maybe 2 or 3 or 4 years after that, I had some really lumpy, noduly bits on my thyroid, but that seems to have all settled down as well. Now, in that last column, I've added a few things in there that are not talked about as much, but are symptoms of hypothyroid, and that is air hunger. So feeling like you can't get enough air into your lungs, that's actually quite a surprisingly common symptom when you start talking to people in thyroid groups. Also, trouble swallowing. So if your thyroid is a little bit swollen, if there's stuff going on there, that can affect your ability to swallow, and it can just feel awkward to swallow. That's been my experience. I don't really have that problem anymore, but I did have for quite a while. Anxiety, of course, can be a symptom. Pounding heart. So the pounding heart at night time, I heard Dr. Elizabeth Bright talking about this in an interview just recently, and that was one of the things that was on my list of symptoms prior to starting carnivore. When I went to bed at night time, I'd be lying there and my heart would just be pounding and feeling like it was going to do something really horrible, and that has stopped since I've been on carnivore as well. So things have obviously improved. I wish I'd had blood tests done prior to carnivore, but I didn't, so I've just got to start from where I am right now. Heart palpitations as well, which have always been a thing for me, because the thyroid hormone helps to regulate the heart rhythm, so that's why it can cause heart problems over time. So those are the common symptoms of hypothyroid. Now, hyperthyroid, when the thyroid's overactive, a lot of those are just basically the opposite. Some of them are the same, but some of them are the opposite. So the hyperthyroid can cause fatigue and depression as well. It can also, it causes diarrhea commonly. It causes itchy skin. So when you're hypothyroid, your skin tends to get itchy because the cells are multiplying faster. Now, weight gain, I was gaining weight initially when my thyroid was becoming hyperactive, I realise now. And even when I did lose some, like once things got really bad, it was just muscle. I didn't lose body fat. I lost muscle and lost all my strength and couldn't do any steps. I couldn't even get up 2 steps at the beach without my husband helping me. If I got on the floor, I couldn't get up off the floor without holding onto something. And yet prior to that, we had owned a gym, and I was teaching group fitness classes and doing lots of weight training, and was really strong. So the hypothyroid can really destroy, really chew up your muscles and basically eliminate those very, very quickly. So some of the other things that hypothyroid causes, which are kind of the opposite, your heart rate goes really fast with hypothyroid. Even your resting heart rate can be really fast. Mine used to sit around 160 beats a minute at resting rate. You get really sensitive to the heat. But I had a lot of mental stuff that was going on when my thyroid was overactive as well, which was really uncomfortable and really hard to deal with and really stressful. I felt like my body was vibrating inside it, inside myself. my anxiety was through the roof, and I was having difficulty understanding people with accents. I couldn't touch type anymore at that stage, and when I'd been touch typing since I was a teenager, and they just had all these bizarre symptoms going on. So yeah, the air hunger can be a thing too with hyperthyroidism, having trouble swallowing, and then the heart stuff as well. So that's the common hypothyroid symptoms and the hyperthyroid symptoms. So as I said, I actually have suspected for a long time that my thyroid has been underactive, but I've had no testing that's been able to confirm that, I guess. And in the past, when I've gone to the doctor and want a thyroid test done, they generally only ever did TSH, and that always came back within the normal range. The only exception to that was basically when my thyroid was overactive, and it came back showing that it was overactive. 10 years ago, I had some testing done, and my test results were within range then. He did test, so this was Greg Emerson in Australia that I went to. He was a very good doctor who lost his license for doing the right thing, as happens. He actually tested my TSH, my free T3 and my free T4, and he also tested 2 of the different types of antibodies, and everything came back within range. So as far as I was concerned, everything was fine. But now, looking at those ranges with the Common Sense Labs book by Dr. Ken Berry, I see that some of those ranges, I was actually out a bit in those ranges. And obviously Greg, even though he was a very good doctor, he wasn't up to speed with the thyroid testing, and so he never said anything about my thyroid back then. So as I explained while I was going through those common symptoms, I've had a lot of those symptoms over the years, right from when I was very young. Some of them, things like feet swelling and weight gain and sluggishness. I mean, even now, like my voice, I've been having problems with my voice for ages, and this hoarse, croaky voice. Someone actually commented on it in one of the videos just recently, and that is a symptom of hypothyroidism. So when I was young, my first pregnancy, I was 17 when I had my daughter. I was 16 when I fell pregnant. I actually gained 6 stone in that pregnancy. So I was 16 years old. My weight went up by 6 stone, which is over 80 pounds or 38 kilos. That's a lot of weight. Now, the gynecologist at that time, he assured me that weight would all fall off after I had my daughter, and that didn't happen. I actually gained more weight after I had her. And I actually never really lost that weight, apart from in my mid-30s when I went on to a fruitarian diet and then vegan diet. I lost a lot of weight then and was basically smaller than I'd ever been. But that was at the expense of a whole lot of muscle and my health. And so that was the beginning of my digestive symptoms getting really bad. And I know that now looking back, but at the time I thought it was great because I had lost all this weight. And so, as I said, my TSH levels, when I've had them tested at other times, have always been within range. And so, as far as the doctor's concerned, everything's fine. Even though I had symptoms of hypothyroidism, nothing was ever done. And so the years have gone by, and you just kind of keep on keeping on. I've spent a lot of years, decades, altering diet, altering lifestyle, exercising like a madwoman, which was probably a mistake now with what I know. But that was the only way to keep myself feeling okay in my body, So I've said in videos before, like I've never really had a time in my life where I've felt great. I go from feeling bad to feeling better, but not feeling great. So there's kind of been this underlying something that's been going on forever that I have suspected over the years was thyroid, but could never really pinpoint any specific evidence because the testing, either the doctors wouldn't do it or TSH just showed up in the normal range. So as I mentioned earlier, I had an overactive thyroid when I was about 48 years old, and I think what happened there was that I had been taking Lugol's Iodine at that stage for maybe, I think about 18 months, 2 years. I'd started taking it after reading Dr. Brownstein's book on thyroid. He is a real advocate for iodine and treated a lot of thyroid patients with Lugol's. And so I was following the protocol in his book basically, and I'd started off on a higher dose of Lugol's, and had really good results with fibrocystic breast disease. So I didn't even kind of realize that that was what I had until I started taking the Lugals, and it went away. And so I went from having these hard, solid breasts that I've had for years to having breasts that were soft and actually felt like the way they were supposed to, which was really bizarre because I wasn't used to them being like that. And so I gradually, from memory, I cut my iodine down until I was taking a couple of drops a day and left it at that. But then when I was 48, I ended up, I had all this stuff going on, and I actually had hypothyroid symptoms. So I was putting it down to thyroid and menopause, and I found a doctor who looked like she was a little bit more of a functional medicine type doctor on the Sunshine Coast, and we went down to the Sunshine Coast. We were living in Hervey Bay at that stage, and I had some testing done there, and that was when I found out that my thyroid was actually overactive. And then I kind of around then started to really get all those hyperthyroid symptoms, and which was really very unpleasant. So since then, I found that I can't take iodine. If I take it, I end up with hypothyroid symptoms again. And even if I take it a few times a week, just a drop, it just causes symptoms. So I don't know why that is. I don't know whether there's still something autoimmune going on there or what. So let's have a look at my results, and I'll explain what the results are, what they mean, and where I'm at now. So I had my thyroid peroxidase tested, which is the antibodies. This is the only test that I could get done doing self-requested testing at our local path lab. And my levels came back at 3.0. So as far as the range from the lab is concerned, that's within the normal range, because anything under 12 is fine. And Dr. Berry says in the Common Sense Labs book, so I have a copy of his book, it says that anything under 6 is fine. So I'm still fine as far as he's concerned as well. He says that the standard ranges in the US, and this is in his book, is between 0 and 34. Isn't that horrific? That level goes up as high as 34, ours is 12. It's just bizarre and quite scary. I would like to have, there's a couple of other antibody tests that can be done. I'd like to have those done, but I'll talk about that at the end of this. So I had a couple of other tests that aren't thyroid tests done while I was there. One was a parathyroid test, and that was purely because the girl suggested it, and I couldn't remember what it was. And I know that I'd looked at having one done and thought about it, and so I said yes. So I had that done, and it's come back normal as well. So the parathyroid, if you don't know what that is, it's a gland at the back of the thyroid gland, and its job is to regulate calcium levels in the body. So according to Dr. Berry's Common Sense Labs book, the symptoms associated with parathyroid issues are often just shrugged off as aging. So they include chronic fatigue, depressed mood, bone and or muscle pain, nausea or abdominal pain, constipation, frequent urination, mental fogginess, heart palpitations, kidney stones, slow thinking, cognition, heartburn, and bone issues like osteopenia and osteoporosis. So that's probably why I thought about getting it done, because quite a few of those symptoms overlap with thyroid symptoms and are things that I'd been kind of experiencing. He says, Dr. Berry says that parathyroid dysregulation is frequently missed, and so it's important to check calcium levels in your annual labs if you have them done. So there's no ranges in there, so Dr. Berry doesn't have any ranges in that book for the parathyroid testing. So I'm assuming that what's come back in my test results is probably fine. So my results came back at 3.9, and the range is 1.6 to 6.9. So I'm kind of in the middle there, I guess. So the other test that I had done that's not thyroid test is ESR, so it's sedimentation rate, and that basically measures your inflammation levels. And so I wanted to check that because I still get a lot of muscle pain in that, but it might just be oxalate dumping. I'm not really sure. My ESR test came back at 8, and the New Zealand range is 1 to 30, so I'm doing quite well there. And for the Common Sense Labs range for optimal is 0 to 18 for women. So I'm doing pretty well there with my inflammation. So that's not what's causing my muscle aches and pains, obviously. So it might just be oxalate dumping, because it kind of comes and goes, but I'm not really sure. So it's really common, when you go to the doctor and they decide to do a TSH test. That's all they usually do, for your TSH to come back in the normal range, and them to tell you that there's nothing wrong with you and that all your symptoms are just in your head. But here's the thing with these tests. So the TSH range in New Zealand here is 0.3 to 5.0, as you can see here. So the thing is that this range from 0.3 to 5.0 has been made up of the 95% of people that get tested that don't have a diagnosed thyroid condition. So what they do is they take 95% of those people who are supposedly disease-free and say, okay, so their ranges vary between this range, this amount, and this amount, and so therefore that is the healthy range for TSH. But the problem with that is that most of the population aren't actually healthy. And these ranges will vary depending on where you live and depending on how healthy the population is where you live. So here in New Zealand, it's 0.3. In the United States, I think looking at Ken Berry's book, it's 0.5. So you might find that in some areas of the world, this is 4.5 up here, or, it varies. And so they use just the 2.5% at either end as being the supposed areas where there's disease present, but the actual range where people feel good is usually in the middle here. Now, according to Ken in Common Sense Labs, what he's found is that the range is between 0.5 and 2, so it's actually down this end rather than being in the middle. And he said in the book that a lot of people actually don't really feel good until they're at 0. So even though you're heading towards hyper at this end and hypo at that end, what Ken is saying is that what he finds is that it's in this range here from 0 or 0.5 to 2.0 is the optimal range for most people. But the thing is with thyroid, as with a lot of things, is that you really need to go by how you feel as well and what symptoms you have. So if you are feeling great at 1, then that's the perfect place for you. So you need to kind of pay attention to your labs, but pay attention to the way you feel, pay attention to your symptoms. You can take your basal body temperature and see where that's at, and use all that to kind of gauge where you're at with your thyroid. So let's get to the TSH test. So my TSH test came back at 3.37. So as I said in that earlier in the video, the range that it comes back from the laboratory isn't optimal. In New Zealand, it says 0.3 to 5.0, and but Common Sense Labs, Dr. Berry's book, says that the optimal range is under 2. He says that patients often feel best, he's found, at 0 or as close to 0 as possible. So 3.37 is actually too high, and so that means that my pituitary gland is telling my body to make more T4 because there's not enough T3 floating around my body. So my free T4 came in low as well, so it came in at 10.0. Now the New Zealand range on the test says 7.0 to 16. But in the Common Sense Labs book, it says 12.87 to 19.31 is optimal. So I'm under that 12.87 at 10. Now, the other thing that I wanted to get my free T3 done, and I had that on my little list to do, but they won't do it. So the Path Lab here in New Zealand will not test free T3 unless your TSH is out of range. And of course, as far as they're concerned, mine is within range, so I can't get that done. So in New Zealand, thankfully, we now have a couple of private labs that will do testing, but they're more expensive. So even getting the patient-requested testing done at Path Lab is quite expensive. I mean, those little handful of tests I did the other day cost me $100. And for me, money's tight. And so this is the reason that I haven't had a lot of testing done so far, and I've been doing it in little bits and pieces because I've been doing it as I can. The options for having testing done privately with these other labs, there's two different ones that I've found. One is called iScreen and one is called My Tests. So My Tests have less tests available and they're a little bit cheaper for some of them, but I have to travel to go and get those done. So they have a limited number of collection centres, and the closest collection centre to me is in Hamilton, which is an hour away. But I can go there and just get a free T3 done, or I can go there and get a package done with the free T3, free T4 and TSH. I don't think they test the antibodies from memory, but iScreen do. So iScreen have a couple of different packages for thyroid testing, and I would really like to get their comprehensive one done. So their comprehensive test does TSH, free T3, free T4, and it does 3 different antibodies. So the two common ones and another one. And I would like to get that done, but it's like $300 nearly to get that test done. So basically it all comes down to money. And I also have a sneaking suspicion that hubby might be hypothyroid as well these days. He's just showing a few little symptoms, and so I'd like to get him tested as well, but it just makes it really tough, financially. I mean, the ideal would be to find a really good functional medicine practitioner and go to someone who really knows what they're doing. But when you can't do that, you just kind of got to do it yourself. So I'm doing what I can as I can. If you're watching this thinking that you might like to help in some way, I do have one membership that I've set up for my YouTube channel now. And so you can click on the join button down below for that. It's a monthly amount of $3.99 New Zealand dollars a month, which works out to probably about $2.50 US. Or you can click on the super thanks and do something like that, or I have links below to buy me a coffee. I also have my store that is set up with my channel, so I mean if you want to go and buy yourself a t-shirt or a hoodie or something like that, that all helps. It all helps me to be able to get my testing done and do what I need to do to try and sort my health out. And if you do that, I thank you so very much. While I'm at that, I want to say, Christine, you know who you are. Thank you so much for being the first person to join my membership. I was really rapt when I saw that you'd done that. I didn't realise that was what you meant when you put that comment in, so thank you very, very much. Now, I also have other links that are below my videos and to products and things that I use, and most of those will pay me a small commission as well if you choose to buy those. And so if you do that, I thank you very much as well. But otherwise, I will keep muddling along and get my testing done as I can. So if and when I manage to get my T3 tested, I will do an update about that as well. So what am I going to do moving forward, apart from trying to get my other testing done? I am using a Lugol solution topically. So I bought this just the other day. It's in a roller, and so you just use it on your skin, and it had really good reviews. So I thought I'll try that. I don't know if it works as well as taking it internally, but I did see that there was someone in there who said that they couldn't take iodine internally, but they can use this. So that kind of gave me a little bit of hope that this might be one way that I can get iodine into my body to help. Now I'm also have just started taking a bovine thyroid supplement from Homegrown Primal here in New Zealand. So they do organ supplements, and they've got 2 thyroid products. One of them is stronger than the other, so I bought the stronger one, but I'm just starting off very, very slowly, taking one of the capsules a day, and then I'll build it up to 2 and see how that goes, because I do not ever want to end up hyperthyroid again, because that was the most horrific experience. So I've been doing the Lugols and the thyroid supplement just for about 3 days now. I think they both arrived the same day, and my temperature this morning was 36.05, so that's probably a little bit better than it's been, which is cool. So fingers crossed. I'm just going to monitor myself by doing my body temperature, and that way if it starts to get too high, then I know I need to back off on some of those things, even if I haven't got symptoms. The other things that I'm doing, I'm using methylene blue, which I've done a couple of videos on, and I've had to back off my dose on that, but I've started on a lower dose, and I'm just gradually building that up a little bit. I'm taking 5 drops a day now, and I've been fine. The the reason for taking the methylene blue is it actually helps with the mitochondria. So when there's thyroid issues, there's mitochondrial issues, and so methylene blue is going to potentially help there. And the other thing is red light therapy. So I have got a red light therapy device coming, and I'm looking forward to that arriving. Red light therapy gets really good results, and there's actually research done on thyroid issues with using red light therapy, where that showed that the people in the test were able to reduce their thyroid medication over time by using red light therapy. So that's really interesting, and because it helps with mitochondrial health, that's something that I wanted to try as well. I've just bought a small device, like it's only I think it's about 30 centimeters square, something like that, but enough that I can use it on that area and on some of these aches and pains as well when I've got them, which will be awesome, hopefully, fingers crossed. So I'll pop links below my videos to the products that I'm using. And so if you're interested in those, you can go and check those out. Now, if you've got any comments or questions, you can pop those below and I'll get to them as soon as I can. If you like this video, make sure to subscribe. I thank you very much for watching this, and I will talk to you again another day.